Let's dive into one thing, which is mold toxin. We know that mold toxin is definitely going to affect detoxability, and it can create a mast cell problem. And I've dealt with mast cell problems myself. I'm slowly but surely getting better and better and better by doing two things. Number one, eliminating the mold toxin using binders. And then number two, stabilizing the mast cells using things like quercetin and other mast cell nutrients. Nettle can be helpful, vitamin C to help degrade histamine, DAO with food to help digest the histamine you're putting in the diet. So I think toxins in general, maybe not just mold, but I think we could say toxins, heavy metals, pesticide, herbicide, anything that's disrupting the gut is going to be important to look for with testing and then to treat.
100%. Yeah. Especially if you can get to the root cause, right? If you're in a moldy home right now, we got to look at that. We got to address it. If you have high levels of mold out of the bat, but you're not in a moldy home, it may be less important to jump on board with detoxification if you already have a lot of crappy digestion issues going on, because we know a lot of mold is going to be eliminated via the hepatobiliary system. So a lot of times we got to time up. Is it the appropriate time to really push and lean on detoxification? That's an important thing. We live in a generation where we know if we have some kind of a toxin exposure, some kind of a gut bug, we want to go after that right now. And sometimes we got to set the table for it, get the foundation moving so we can manage that better.
Yeah, well said. So let's chat on the sulfur piece. You brought up sulfur. So what are things we can do to boost sulfur? Because this is going to help with the salicylate problem. And then also, I know, boosting sulfur is going to help with detox, right? And it's going to help boost glutathione production too.
Great question. Let me share my screen here so you guys can see some stuff. All right. So this is one of the eating plans that I made, over the years. I'm changing it all the time for my patients to kind of help them, give them good feedback. But the key thing is we've got to have healthy levels of protein in every meal. All right. And so typically I'm doing a palm to a fist to a full hand of protein. Now, if I have someone coming in with really crappy digestion and they're maybe a previous vegan, they may only be able to handle like one bite of like salmon or something. Right. So this is like a general template, but it may not work for everyone depending on how bad your digestion is. I always tell patients the worse your digestion is, we lean to like gentle stews and soups where it's just easier on the body, easy to handle. And I try to, eat enough so someone can last about 4 to 5 hours. But sometimes if their digestion stinks, they may only be able to eat enough for 2 to 3 hours because a smaller amount of food, less food in your tummy, and then you just come back more frequently, right? It's not ideal in the, intermittent fasting, insulin sensitivity world, right? Because you want to have more time between meals and not be grazing all the time. But from a digestive health standpoint, that may be what's necessary. And then in general, just to look at my eating plan here, healthy proteins, healthy carbs, right? And you can see some of the carbs that are going to be higher in FODMAPs, right? You can see some of the autoimmune foods that are in red, right? So we want to avoid the autoimmune foods. We want to be doing more of our non-starchy vegetables without the F's next to them, ideally cooked, steamed, sauteed, and then avoiding some of the FODMAPs, right? Now, for my patients, I have an expandable FODMAP handout here. So it's more in depth, right? You'll see this come up in a second. This is helpful here. There's also a great app that I use for things that may be more nuanced called FODMAP A to Z. That's a great one. And then we use some of these oxalates. Like we'll look at some of the, I try not to overthink it with the oxalates. I just try to look at and say, what are the top 3 to 5 things that you're doing maybe on the oxalate side or on the salicylate side if they're really sensitive, right? We may just jump onto a carnivore diet and automatically eliminate these. We may just look at these more specifically and let's highlight the ones that are the most high. Right. And this is one given out by University of Pittsburgh Medical Center. But you can see we just try to look at the high ones and try to just replace them with a low one. If we're seeing someone let's say, consume a lot of teas, right? Or we're seeing someone do a lot of nuts, right? And again, if you do like an autoimmune paleo template, guess what happens? You're already cutting out almonds. You're already cutting out nuts. You're already cutting out soy, right? So a lot of times we get a reduction doing some of the templates that I talk about here in my meal map just naturally. Okay. And then of course, if we have a lot of eczema issues, we may also be looking at this as well and trying to look at some of the higher salicylate foods here. And again, it gets overwhelming. So if you're, like I mentioned earlier, if you're coming into this with a standard American diet and you're not that great to begin with, don't worry about this. Forget about it. Just get a good foundation. Once the foundation's solid and you're not quite moving the needle, this is where you work with a practitioner to get to the next level. So I just don't want anyone coming in that doesn't have a great diet and looks at this and is like, holy crap, forget this. This is too confusing. Don't worry about that. Push that aside. This is for people that are already kind of flatlined on that, and there are options.